Well, welcome back. 9:47. Hold on.
Yeah.
Make sure.
Let me see.
Yeah,
okay.
we good? Okay.
Yep, you look good.
In your health watch, your oral health can be a good indicator of your overall health.
Yeah, it really can. Desiree is at Swiss Biologic to break down what you need to know this morning. Hi, Desiree.
Hey, yes, Swiss Biologic Dentistry right here in Phoenix, you guys. We are here with Dr. Amelia Ellingson this morning talking about our oral health, right? And I think oftentimes folks don't realize it's connected to almost every other part of our body.
Yeah, I don't think we can look at the mouth as separate, so I always explain to patients that any kind of inflammation anywhere, whether it's on our leg or in our mouth, is going to stress our body and cause symptoms such as tiredness, brain fog. It's going to compromise our heart health, our cardiovascular health. So whenever we're talking to patients and we're seeing a lot of gum inflammation in the mouth, then that's saying that there's a lot of inflammatory markers and inflammatory types of bacteria that's traveling along that whole digestive system.
I have a feeling we have a pretty good patient with good oral health here this morning. But for example, if he were to come in and maybe have some concerns about his gum health,
yes.
What would a check look like? What would it be that you're looking for?
Well, one of the great tools that we have nowadays are oral microbiome tests. So these tests are very simple. They can be ordered online. You don't even need to go to a dental office in order to get an oral microbiome test. There's a lot of different ones out there if you just do a search, and then you will get an idea of kind of your overall picture of what's going on in your oral microbiome and how that might be affecting the rest of your body. There's a known relation or correlation between periodontal disease and gum disease and heart health.
Why is that the case? So if I have inflamed gums and I'm having issues, how does what's happening in my gums affect my heart?
Well, it has a lot to do, like I said, with just our overall health. So anytime we have a lot of inflammatory markers that are going on in our body and we have a bad diet, we end up stiffening those arterial and veins, and we end up getting more cardiovascular issues. So the plaques that form around our teeth can also be plaques that form in our blood vessels. Okay. So we're actually finding a correlation between those things. So we have a lot of that type of bacteria. It definitely affects the cardiovascular health, and we find increases in blood pressure, and we can actually even find issues with sleep apnea, higher chances of heart attacks. And the other thing that comes along with having an untreated tooth infection per se.
Yeah, we don't want to skip. We don't want to gloss over any issues we might be having.
Yeah, is that that's going to affect our whole entire body, because now our immune system is extremely taxed. So we're going to have more issues with constant fatigue, with brain fog, besides the pain that comes along with that, as well as with gum disease, having issues with that. So we can look at different things like oil pulling, water picking, flossing, but also looking at our overall diet is very, very important. So we want to stay away from...
So it starts with what we're eating, what goes in our mouth, how we're cleaning our mouth, oil pulling, water picking, flossing, tongue scraping. It's all good in combination to keep a healthy mouth, you guys. We'll send it back to you.
I know that you're talking. I'm like, oh boy, do I need to up my flossing game?
I don't smell anything, so you're good to go.
Good to know.